I want to piggyback off of what Sergeant Major's remarks, and I appreciate your remarks, Sergeant Major. I also want to start off by apologizing because I take great pride in normally being a problem solver. My wife here of 22 years will tell you I even try to solve problems I'm not supposed to solve, right? But instead, this becomes a request. I'm always grateful whenever I'm in the company of General Garrett because he always says something that is simple but profound. And what he talked about today is how being in the military is a family, right? It's why I continue to serve. I'm sure hearing your remarks is why y'all continue to serve as well. I bring that up because there's always, and everyone that wears a uniform knows this. In fact, their spouses know it because we always bring our work home. But we always have those conversations at all levels, and we try to keep it horizontal instead of vertical. And what I've found, though, getting to the point now, is we have a lot of folks that are, unfortunately, sometimes thinking about hurting themselves, right? And it's not a pat me on the back, it's actually the opposite. But one of the biggest reasons why I continue to remind myself on certain days to serve is because I have actually had an opportunity where I prevented a suicide with somebody that I commanded. And it was not the suicide that was the issue, it was the way they started the conversation. The conversation was started by saying, came in, closed the door, he's very cool as a cucumber, and he said, hey sir, I'm just gonna have this conversation with you, you're available, because I wanna give you the opportunity to prevent me from killing myself. And he was very calm about it to the point where it freaked me out because he was so calm and he was one of the best NCOs I've ever served with. And he's since become better, okay? He really does. Our conversations really made a difference, and it reminded me the value of the family aspect of why we serve, right? Even to this day. The reason why I bring that up though is I am now 24 years in, have had several opportunities, always grateful to command, and I continue to have conversations with folks that not exactly at his level, but they teeter on, they're really like in a bad spot in their lives. And of course, as a commander, well-programmed, I sit there going, you ever thought about using some of the resources we have available? And the common conversation I tend to get is, oh no sir, I can't do that. Why? Because I don't want that stigma, right? Because they know perception equals reality, because we say it ever since we hit basic training. So this is why it's the request piece. Just as recently as just last couple days, I've had someone in my command, really good officer, come to me somewhat embarrassed, and as we know, pride, good pride, not the sinful pride, but good pride, is part of our DNA. And just to even go to airborne school, if you've already seen a behavioral health therapist, it kind of gets you flagged in the system. And then they have to come to a leader, and fortunately, if you're doing by the family aspect, because in my opinion, the good commanders, the good sergeant majors, they have families, right? The ones that are not, it is what it is. They come to you a little bit embarrassed, of course, and you can tell it's a tremendous, episode in their lives to try to, hey, sir, can you sign this waiver so I can, be a great American and jump out of a perfectly good airplane, right? And that's a significant emotional event for them. And we want to talk about retention. Those are the type of things I don't think we talk enough about. And it's not just that. There's folks at PCS, and depending on where you go, because not all installations follow the rules the same way, they kind of get flagged during the installation process, and they have to go see somebody to clear that they were good, even though they reached out and did exactly what we asked them to do all the time, and that is get help. And I just say this before I get off the podium, my context is, and I'm very fortunate for everything I've done, but I was spoiled 2 platoons in combat right off the starting, my career as a commissioned officer. But seeing that generation that went to war, came back, challenged their families, as they're going through and seeing different versions of us, and then trying to use the very resources, which are plentiful if we actually communicate with our folks, and then later on regretting it. So it's just a request, ma'am. Once again, apologize for not having a solution here, but I have a request from a personal part for my families, the different tribes that I've served with, that maybe we can take a look at the system holistically to make sure that, the flags make sense, especially if people have had the service, that they did to get better many, many moons ago. So now I get off the stage, but I do appreciate all your comments, and I appreciate what y'all do every day.
Yeah, so I'll address that. Is something a conversation that we have with the G2. of the Army. And so we've worked very hard to address behavioral health items in the record, just as we would orthopedic items in the record. And so I appreciate your comment. It tells me that we need to circle back and see how well we're doing with that, because I've been doing this for 30 years as well. And so I've seen us go from in my early days, it really was an issue. Any behavioral health visit, you were gonna get flagged. Then we went and they actually were very intentional, changed the policy and said, no, a behavioral health issue is not gonna, just a behavioral health issue visit is not gonna get you flagged. Now, just like an orthopedic issue, if it's a knee that you can't run on, then I do need to check you out before I ask you to run again. So we wanna make sure that we're finding that balance between not stigmatizing while also not putting people in conditions that are gonna make their physical condition worse. So I'll recommit to you that I'll circle back on that one and get a check on where we stand. But the ideal is to be exactly where you're talking, is that absolutely, come on in and see me for behavioral health. And if your condition is treated to the state that it's not gonna make you worse to put you in that condition, absolutely, let's go do it. If it will, let's address that. And sometimes that does mean stepping back from that school for a moment, or sometimes it means that's not the thing that we are gonna serve, and having the honest conversation with the soldier. Let's have you serve in a way that's gonna be good for you and good for the Army. So we definitely owe you that.
Thank you, ma'am.